So yes, we have two separate issues today. The first is that the bulk carrier, the Sanyo, came into the Torres Strait waters on Monday and asked for a pilot, and then disclosed that they had a lot of sick people on that ship. So there were 21 crew on that ship and a lot of them were sick. So we sent out nurses onto that ship who tested them all through yesterday, and we got those results late last night, and 19 out of the 21 are positive. So then we worked very closely, as we always do, with MSQ, who are the lead for this, Maritime Safety Queensland, to organise the best possible response to keep the crew on this ship safe, to keep the ship safe, and to keep the people of Queensland safe. So it's been organised that that ship will steam around to Weipa, and it should be, if it hasn't arrived already this morning, it should be arriving fairly soon into Weipa. Then we will organise to take those sick crew off that ship, maintaining enough crew on the ship to keep that ship safe, and we work through MSQ to sort that out, and then we'll bring those sick crew down to Brisbane to be managed in one of our COVID facilities in Brisbane. So all of that is happening as we speak. Now, that ship came originally from the Philippines, and all the crew, I understand, are from the Philippines. Now then, the second issue is that we have a gentleman who was in hotel quarantine at the Quest Hotel in Brisbane, left hotel quarantine after 3 negative tests, then subsequently became unwell, so went to the Royal Brisbane Women's Hospital Emergency Department, where he was tested late on Monday night, and that test came back late yesterday as positive. So he's been infectious in the community since the 22nd of July. Now, he's been staying at that Backpackers Hotel on Roma Street. So we'll now go and contact trace the people in that Backpackers hotel and other people that this gentleman's been in contact with. Now, this is our 13th incursion of the virus into the community in Queensland over the last 6 weeks. So it is becoming increasingly concerning that we are having these repeated incursions of the virus into Queensland. So thank you very much to those more than 17,000 people who came out and got tested yesterday. This is what we must continue to do going forward. And it doesn't matter where you are in the state, because as we can see, these backpackers, when we follow up with all of them, could have gone anywhere in the state. Or the people, given that we don't necessarily have backpackers at this point in time, the people who have been staying in that hotel could have gone anywhere in Queensland. So it is really, really important, please, anyone in Queensland, any symptoms at all, come forward and get tested. The second thing is masks are critical. We know they make a difference, and I'm sure they've played a role in why we've not had widespread community transmission from any of these 13 incursions of the virus. So that's really, really important. But most importantly of all, if you are sick, please stay home and immediately get tested. Then I also want to thank those more than 2,000 Queenslanders who are in home quarantine and I know are following the instructions and staying at home. That is critical because you are the highest risk to our community. You have been deemed a contact so that you need to be in quarantine, and we've put you in your home. So that's why we're going ahead on Friday, as the risk in those two southern states where we've declared hotspots in South Australia and Victoria, as their risk decreases, which is excellent news, they've removed their stay-at-home orders, then we've made a decision that Queenslanders who are coming back home to Queensland, that we think that we can safely allow them to quarantine if they've got a suitable home at home for the 14 days. So anyone arriving into Queensland who's able to come into Queensland, because those two states are still declared hotspots, can go home if they've got a suitable home and quarantine at home for 14 days. So we'll work through how that works. But it isn't about lifting our border restrictions. Our border restrictions are exactly the same. We still have those hotspots declared, and we'll review that as Victoria and South Australia review their restrictions. So both those states have decided that although they've removed the stay-at-home orders, they still have significant restrictions on what people can do in those two states. So while they have those significant restrictions, we'll continue to maintain a tight domestic border with those two states. Thank you. Oh, one last thing. Given that we are seeing increased numbers of cases across Australia, so in New South Wales they are now well over 2,000 cases related to their latest outbreak related to that limousine driver on the 16th of June, it is very, very important that we are not complacent in Queensland when it comes to vaccination. That may be what makes the difference going forward. So if we do have an outbreak in Queensland, we can see in New South Wales the people who have been protected are the people who have been vaccinated. So it is really important that if you are vulnerable, that you get vaccinated. And particularly, we know that the biggest vulnerability is older age. So anyone who is 60 years of age or older, if you haven't already gone and got vaccinated, now is the time to go and immediately do it. So go and see your GP or go to one of the vaccine clinics, particularly that the Commonwealth is running, or one of the pharmacies, and get your AstraZeneca dose. If you've already had one dose, it's really important. We know that the efficacy steeply increases with that second dose. So if it's 12 weeks since your first dose of AstraZeneca, make sure you go and get the second dose as soon as you can when you reach that 12-week interval.